Today, Monday, August 3rd, 2020. Roll call, please.
Reagan.
Here.
Forsythe.
Here.
Lightfoot.
Here.
Sheridan.
Here.
Smithers.
Here.
Denisha.
Here.
Perkins.
Here.
Akers.
Here.
Bank.
Here.
Haggard.
Here.
Diaco. Burke.
Here.
Arquette.
Here.
Terminelli.
Here.
Curran. Here. 14 present.
Thank you. Would the deputy clerk read the call to the public hearing, please?
Notice is hereby given by the chair of the St. Lawrence County Board of Legislators that the chair and the members of the Board of Legislators of the County of St. Lawrence will meet at the Board of Legislators Chambers Courthouse located at 48 Court Street, Canaan, New York at 5:45 p.m. on Monday, August 3rd, 2020 for the purpose of conducting a public hearing regarding adopting local law A for the year 2020, setting salaries for county employees. Be it enacted by the St. Lawrence County Board of Legislators as follows. Section 1. For the year 2020, salaries for the following individuals shall be increased by 2.75% as follows. And those not at the maximum for the pay grade will advance one step on the schedule. Conflict defender, $102,818. County administrator, $125,997. County attorney, $121,284. County clerk, $90,361. County treasurer, $90,361. Director of Human Resources, $102,818. Director of Real Property, $84,177. Election commissioners, $67,737. Highway superintendent, $111,141. Public defender, $91,483. Sheriff, $102,818. Commissioner of Social Services not currently filled. Section 2, the local law shall take effect in accordance with the municipal home rule law of the state of New York.
Thank you.
Sure.
And Mr. Smithers?
Could I ask you, could you read again the salary proposal for the election commissioner and public defender? Because
The
the figures aren't matching those.
The election commissioner, $67,738. And who was the other one?
Public defender,
The public defender, $93,221.
that's what I have.
All set? Okay. Yeah, Mr. Fay?
And mine says 2021.
What I have in front of me says 93,221.
No, I'm talking about the year.
Oh, for the year 2020?
Yes.
Yes. Okay. For 2020,
I can explain that.
go ahead.
So this is to accompany the CSEA contract that's recently been settled. You will see in the budget the salaries for 2021. So none of these positions have received any increases that CSEA or management have now been applied.
Okay.
So in other words, it's because of the contractual agreement that we just reached with them for not only upcoming years, but for this year also. Okay? Anyone else? All right. Now is the time for anybody in the public who wishes to comment. Any citizen wanting to address the board is asked to stand at the microphone during the time that they address the board. The address will be limited to a time of 5 minutes. Please state your name before beginning your address. Is there anyone that wishes to address the board at this public hearing? Seeing none, hearing is closed. We're adjourned until 6 o'clock for the full board meeting.
Check, see if I.
Could you call to order the Monday, August 3rd meeting of the St. Lawrence County Board of Legislators? I entertain a motion to suspend the rules by Legislator Curran, seconded by Mr. Forsythe. Any discussion? All in favor?
Aye.
Opposed? Carried. Roll call, please.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Here.
Sheridan,
Here.
Smithers,
Here.
Denisha,
Here.
Perkins,
Here.
Akers,
Here.
Bay,
Here.
Hager,
Here.
Piaco,
Here.
Terminelli,
Here.
Curran. Here. 15 present.
Thank you. Next, we would move to the prayer, followed by the Pledge of Allegiance. Prayer by Mr. Denisha.
Thank you, Mr. Chairman. At this moment, I would ask for a moment of silence in memory of lost loved ones due to the pandemic and or other causes. Thank you. Heavenly Father, we thank you for the opportunity to gather here this evening. Please accept our continued gratitude for the numerous blessings you have bestowed upon us. We ask that you provide guidance to us and all the residents of our country as we struggle as a nation through these uncertain and divisive times. We also ask that your divine presence provides comfort to those who are ill, those who are less fortunate, and those who despair through the loss of loved ones, and in many cases, their life is lost. For all these things, we ask your blessing in your Son and our Lord, Jesus Christ, in whose name all things are possible. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I entertain a motion to approve the agenda. By Mr. Smithers, seconded by Mr. Forsythe. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. I would entertain a motion to approve the minutes of the July 6th board meeting by Ms. Curran, seconded by Mr. Sheridan. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. At this time, we will have an update regarding COVID-19. I see Dr. Williams. Are you first, or is Dr. McGuire? Dr. McGuire, you got the short straw.
Okay, thank you. So we put some slides together tonight as well. You can go to the next slide, please. This is the update that we give to Facebook each day. So as you can see right now, we have 258 cases. There are 6 active cases, which 4 of those are hospitalized right now. And to date, we have had 4 deaths. Next slide, please. So as I mentioned, we currently have 258 cases. We had 1 new case just over this past weekend. 5 of the active cases right now do have symptoms, and 2 of these cases are related to screening prior to a medical procedure. So keep in mind, these folks are those who got tested that are positive but did not know, and they had this screening just simply so that they could have the procedure. So far, we have had 1 new case this week. I put the testing sites and their phone numbers here just to remind everyone. These are the phone numbers you can call for a test. These days, most everyone can be tested. So you can call these numbers. They do take it by by an appointment only. Last week at this meeting, we had 254 cases. So there's been 4 new cases just in the last week. Next slide. So here it just shows that we had that uptick last month, and we are kind of showing that we are coming down. Last month, we did have a week period where we had 14 cases just in this week. And as you'll see, next slide, please. On a weekly basis, we're now back down again. And so far for this week, we've only had 3 cases. So that's a drop, as you can see by the graph, as compared to the last 2 weeks. Next slide. For a case average by day, we are also decreasing. So right now we're at 0.5 cases per day. We still have 1 day left in this week for the reporting, because we usually do from Wednesday to Tuesday, but this is a lot lower than we've seen for last month. Next slide, please. Here I just report what we're seeing by age. And so again, like we mentioned last week, we have 3 age groups that really stand out. The one that is highlighted, the 51 to 60, that is where the average cases have fallen for this week. Next slide, please. And by sex, we're staying the same. We're about at 54% being female. Next slide, please. This just shows who we have had in isolation or quarantine since we started in March. We currently have seen about 2,500 that have went through isolation or quarantine. So like I said, we currently have 6 that are in active isolation. We have 62 people who are in the mandatory quarantine and 336 who are in the precautionary. And I'll get into kind of how those splay out in just a minute. Next slide, please. So we have had 18 weeks of the response. We're just going to be kind of coming up on the close of the 19th week. But again, our first case was on March 25th. And you can see here during each of the months how we rose and then fell again with cases. And then we kind of rose back up for the last month. We have also seen more people go through the quarantine process. And this is always due to when we have more cases, and now due to the travel advisory that we do have. Next slide, please. I just wanted to do a comparison of the last 2 months that we've had. So on 6/1, we had 205 cases, where on July 1, we had 217. At both of the first dates of those months, we had no one in the hospital. And you can see during that 1 month time period, we had about 20 people do the completion of isolation. At the beginning of June, we only had 2 deaths. And at the beginning of July, we had 3. And now, as you know, we've had our 4th. During the month of June, we had 12 new cases. And of those cases, 2 had the symptoms. 8 were due to the nursing home staff that had to go through the regular testing. We didn't have any due to travel, because that started on the 25th of June that we had to start to put people into the quarantine process. We had none or no cases due to a screening because of a procedure, and we had 1 hospitalization during that month. For the month of July, we had 40 new cases, and 23 of these had symptoms. So like I've mentioned in the past, we've seen people just be more ill. 10 of these 40 were due to travel, and that's due to the travel advisory. 8 were either nursing home staff or a resident. 13 were related to a gathering. 6 were due to a screening due to a medical procedure, and we had 7 hospitalizations. Of note, the average age of cases in June was 34 years, where in July it was 44. So that's the comparison of what we can see. And you can see that there was more cases and people were more ill as well. Next slide, please. There are currently 34 states in the advisory, and these states are updated on a weekly basis. And so Tuesday is the day that the new states kind of come out. So you should be watching for that because they should be out in the morning. Next slide, please. Due to the travel advisory, we have seen just over 50,000 people be identified, and this is for the state. We have seen about 484 that were positive. So due to the travel advisory, these people were kind of captured in the system so that we could get them to be isolated. We are currently using the New York State, the virtual team. So I've mentioned that we have 336 people in quarantine, and this is the precautionary quarantine. So this is the quarantine that you go into due to travel. And all of these individuals are being monitored right now by the virtual team, which has taken just a significant lift from our department. And so this virtual team, they function out of the central region. And so they have been assisting us. All of the data, and I've mentioned that there's a form that you fill out at the airports, can be online or a paper form. That data goes into the ComCare system. So New York State keeps all of the data on these individuals. We are the 16th county out of the 57 in the state with regards to how many travelers we have put into quarantine. And for the North Country, we are second. We have had 576 people go into quarantine because of the travel advisory. And here just list the states. So the ones in red were the ones that were added last week. We get a lot of questions in our office about isolation and quarantine. So I just wanted to go over this again. If you go into isolation, it's because you test positive, and you must go into isolation for at least 10 days from the day that your symptoms start or the day that you had your test. You go into quarantine if you are exposed to a positive person or if you have done any travel. So that could be due to a close contact with someone who is positive, or you can have done travel from a country or a state with high case numbers. Next slide, please. So when we explain that, we get a lot of questions on, well, so when can I get out? And I just wanted to go over, because we do get a lot of questions, that for isolation, it's at least 10 days. And you have to show that you no longer have a fever for at least 72 hours, and that all of the other symptoms are kind of improving. So it's at least 10 days, and that's from the day that your symptoms started or that you had the test. And so you can see that by the time the public health department reaches out and talks to the person, it may not be 10 days from that day. It's 10 days from when the symptoms started or from when you had the test. For quarantine is always 14 days, and it's 14 days from the last day of the exposure. So that could be from the person who tested positive or from the state that you left that is at high risk. So we get a lot of questions that, well, if I get a test during that 14 days and that test then becomes negative, do I have to stay in quarantine for the whole time? The answer is yes. We also get the question, if the person who I was exposed to tested positive is no longer in isolation, do I have to stay just in the quarantine process? And the answer is yes. And that period cannot change because of the 14 days that you could start to see the symptoms. And so that is incubation period. And so just because you test negative on one day, or the person who you have had the exposure from is done, we have to watch that 14 day. Next slide, please. So we get several questions like this, and this is how we're trying to address it. We do try to be just very transparent by putting maps out and trying to answer questions. So this is one that we have Joe's just most recently made, and we will be posting to Facebook. Next slide, please. This is one that we put out a few weeks ago because our numbers are not tracking with the state's the state tracker. And so we just want to make sure that people understand why it's different. We do try to find why our numbers are different. We try to locate those, but it's due to the address that is kind of reported. There are duplicate tests sometimes, so we are trying just to figure that out. But if you look at all of the counties, they're not in alignment with what the state is currently saying. Next slide, please. So this didn't come out very well, but that graph is the one that I showed you. And this is a dashboard that we provide to partners on a weekly basis so that they can see just all of the numbers. They can see what we're doing with the quarantine process. And then these are the maps that we also post to the county website and to Facebook. Next slide, please. I just wanted to make a clarification on the active case map. We were doing a highlight of those new cases. We stopped putting the highlight of new cases on because it was getting kind of too challenging to explain what we were seeing. At times, we talked to somebody who has had a test and actually waited 10 days or more for the results. And so by the time we know of the new case, their isolation period is done. And so while they're a new case that they'll show up in the township, they won't show up just as an active case because they don't need to do the isolation process. So that's just something to keep in mind, is that the time for testing has kind of varied through the weeks. And there's been many people who have been asymptomatic. So that's why it's just really important that we do follow the recommendations for mask wearing and to practice the social distancing. Next slide, please. We do have this resource for all the partners, and just to go over this again, as people are kind of opening up more, we have a lot of guidance on face mask wearing for the do's and don'ts for people who want to train their staff, just for people, and we add things as they become new and important. And my last slide is just to remember what we all need to be doing as a community. Wear a mask, practice the social distancing, wash your hands, stay home if you're sick, and try to stay local. And now I'll pass it on to Dr. Williams.
Thanks, Dana. Thanks, Dana. So I was going to go over a couple things. The first thing I wanted to start with is talking about an overview of testing. A key element of the public health response is to test patients for COVID. And I wanted to just clarify the different kinds of tests and the appropriate use of those tests. There will not be a quiz after this. So there are three basic types of tests that are currently available. The first type is called a molecular or a PCR test. The second type is an antigen test. And the third type is an antibody test. I'm going to explain the molecular test first. So the molecular PCR test is actually looking for viral RNA. The collection for this test is with a nasopharyngeal swab, a nasal or an oral sample. And this is a test that can be done on a rapid within 1 hour, or more commonly, it's sent out to a reference lab which can take several days, and as I'll talk about later, can take up to 10 to 12 days. Unfortunately, we have a limited access to the rapid version of this test, so that's why we send them out to reference labs. So this test is really the gold standard. This is the test that you can use because it's accurate enough to look for people who are with symptoms or without symptoms. And this is the test that we use in the hospital setting, or a test that the universities are using because it's such an accurate, high quality test. The second kind of test is called an antigen test. And the antigen test, rather than looking for the RNA, is actually looking for parts of the virus, like a protein. The collection is the same. The main difference is these are available at the point of care. So they can be available in urgent care offices or in doctor's offices, and you can get the results back within 30 minutes. The problem with the antigen tests, even though they're appealing because of their speed, they're really only appropriate for testing people who have symptoms. So people who have fever, cough, change in sense of smell and taste, things like that. The negative test is considered unreliable, and so it's not appropriate because of the high rates of false negatives to test certain people. So as I mentioned at our previous meeting, the Association for Public Health Labs issued a guidance saying specifically that these tests should not be used for screening individuals without symptoms. So it should not be used for screening high-risk travelers, essential employees, or preoperative patients. And I would suggest that using it in that context is likely just to provide false reassurance to a community that people don't have this disease, because that's not what it's designed for. The third kind of test are the antibody tests, and there's quite a bit of media about these antibody tests. They're also called serology tests, and they're looking for evidence of antibodies. This is a blood draw, so it's a different collection. And it can be run at our local hospitals, or it can be sent to a reference lab. So you can get these test results back within the same day, or sometimes up to a few days. But again, this test is really, it's not for diagnosing an active infection, it's for documenting a previous infection. So it's very helpful for epidemiologic studies. It's also helpful to identify people who have previously had the disease and may have what's called convalescent plasma that can be used to treat people who are currently ill. But it's not a screening test. And the issue of the concept of using it to prove that someone was immune, I think, is still for debate, as we're trying to figure out whether people really truly become effectively immune to this disease or not. The challenges we're facing in terms of the testing right now are number one, inappropriate test utilization. So as I talked about, the difference between when an antigen test could be used versus a molecular test. The other thing is cost. So for the PCR test, it can be between $100 and $150. It's a little bit less for the rapid test and for the antibody tests, but it's still a cost, and trying to figure out who's going to cover this is often an issue. Perhaps the most pressing issue is turnaround times. So I think people have realized that in the past month or so, the turnaround times have increased to greater than 10 days. And the turnaround time is the time between when we collect the sample and when an individual gets their results. As Dana said, sometimes the tests were coming back 11 or 12 days after the sample was taken. So she's basically calling people to tell them that they should have been in isolation instead of that they should be in isolation. So you can imagine that poses real challenges for public health. What I want to point out is that it's sort of a simple mathematical equation. As the number of COVID tests go up in the US, and that's what that graph shows, and you have inadequate testing resources on a national level, you simply end up with testing delays. The good news is in the past week, there's been significant improvement. And as of today, many of the labs are reporting about a 3-day turnaround time, which is a lot better than the 10 days or 12 days that we dealt with a couple weeks ago. One of the reasons that we're seeing the better turnaround times are because of pooled testing. And I've mentioned pooled testing a few times before, but I wanted to just illustrate exactly what pooled testing means. So the idea with pooled testing is you collect specimens from multiple individuals, but then you run one test. If that one test is negative, then you're good. All 4 people are by definition negative. If that sample is positive, you basically retest each individual sample, and in that way you identify the person who was positive in that pool. So it's just one of the things that's happened recently that's allowed the testing times to be improved. And so LabCorp and BioReference both received their FDA approval to do this kind of testing. And as you'll see, some of the universities are going to use these resources. The next thing I want to talk about, I think this was a request of one of the legislators at the last meeting, was to talk about the differences between seasonal influenza and COVID-19. A couple of comparison points. So if you recall, there's something called the R0 number, which basically shows how contagious a virus is. And what you can see is that COVID is substantially more contagious than influenza. It also has a longer incubation time, which makes it more insidious and more difficult to track down from a public health perspective. More likely that people are going to be symptomatic and not know it. The hospitalization rate is substantially higher than with influenza, and the case fatality rate suggests that it's more deadly. The other characteristic we're all familiar with is as people advance in age, they're much more likely to die when they become infected with a virus. And then finally, what you see is that the CDC finally came out with their best estimate for deaths from the 2018-2019 influenza season. And as you can see, if you measure from right now, we have approximately 160,000 deaths so far from COVID-19. It's almost 8 times more deadly. And of course, COVID isn't over yet, unfortunately. The other thing that I think is unique in some ways to COVID, at least compared to influenza, is that while there's an acute illness, there's also chronic complications. And what we're seeing is that there's multiple systems that are involved. And that's really probably because the virus, there's almost 2 phases of this illness. People get the viral infection, and then their immune system, in the process of trying to fight that virus, ends up causing quite a bit of damage. So what we're seeing now is what people are referring to as COVID survivors. And these are people who end up having chronic disabilities. And this is something that's not really captured in the death rate. Now, this isn't everyone, and I'm going to talk about that later, but for people who do get the severe version of this, what we're seeing is that, there was a study that showed that of people who presented to the emergency room because of COVID, 1.6 of them had had a stroke, and some of them have had, chronic disability related to that stroke. And somewhere between 40 and 60% of patients have had neurologic symptoms. And there's also evidence of persistence. So some people 3 or 4 months out are describing an inability to concentrate. These are people who had jobs where that was required. The other thing is blood clots. This is a very odd disease, and we have almost 1/3 of patients who are severely ill or end up with life-threatening blood clots. If they survive the blood clot, they often are dealing with being on chronic therapy for their blood clots and other complications. Kidney failure, another system that's affected with COVID. And in a series that they looked at in New York City, they said between 40 and 80% of patients had some degree of kidney failure. Some of them requiring temporary dialysis, but some of them with permanent kidney failure. The other system that it impacts is the heart. And we saw quite a large percentage of people with either acute heart attacks, or just this last week, somebody did a study where they did cardiac MRIs of people who had actually recovered, and 78% of them had evidence of ongoing inflammation or other damage from the virus that they apparently had recovered from. And in that series, it was done in Germany. These were people who were hospitalized and people who were not hospitalized. So that's especially concerning. And then finally, with the lungs, more than 70% of people have evidence of inflammation in their lungs when they're diagnosed. And what we're seeing now is many people develop what's called pulmonary fibrosis, which can lead to significant disability over time. So The bottom line in terms of COVID-19 versus the flu is, COVID-19 is clearly capable of causing widespread death and disease to a degree that we really don't see with seasonal influenza. I would argue that underestimation of this virus continues to have tragic consequences, and that an ongoing delay in implementing sensible mitigation measures has already led to increased death and suffering, as well as increased economic hardship. So that was my answer to the difference between COVID-19 and the flu. I don't want this to be a depressing review, so I did want to talk about a couple of good news features. So this is the regional dashboard. And I just want to point out that after our initial wave, really the North Country region has enjoyed a low prevalence of this illness. Dana did point out that we had a great June, that July was not so great. I'm hoping that August will continue to be positive. But if you look at the region as a whole, we've actually done quite well since the initial wave. And the other thing I want to point out is, despite what I talked about with a chronic disability and the multiple systems that are involved, at least 80% of the cases are considered non-severe. So it's important to keep that perspective. And I think as Dana talks about, people without any symptoms or people with mild symptoms, we do need to remember that about 80% of people have what's considered non-severe version of this. 15% are severe and 5% are critical. And that's really what's contributing to the death rate as well as the disability we talked about. I want to switch to just talking about the question of back to school. I think this is on everyone's mind in the community and also nationally. So primary, secondary, universities are all looking to come back. I think it begs the question of why reopen? I think we're all aware that there's significant both health and economic impacts of not opening. And for primary and secondary schools, clearly there's a need for education. We need equal access to services. We have lots of folks in the community with disabilities. They're really not able to get the same services when they're in the home environment. And then for parents, many parents have jobs. They're an important part of the economy. And to be able to have childcare, throughout the year is a real challenge that I think would have negative impacts on our economy. As far as universities, as you know, we have 4 colleges in our community. And if you combine them, they've done studies that basically there's a $1 billion annual economic impact on the region. There's nearly 3,000 employees. And I think it's important for people to realize that many of the students are from our community. If they're not from our community, they're from our region. If they're not from our region, they're from New York State. So as we look at the primary and secondary schools, and Dana and I have been working with the school superintendents and communicating with the school nurses, I think everyone's aware that New York State put out guidance with all kinds of different sort of comprehensive features, including screening the students before they come to school, doing a hybrid of in-person and online education, looking at decompressing the classroom size, and basically doing the 5 pillars of community response, but in a school setting. The local medical community, both Claxton, Hepburn, and St. Lawrence Health System, are planning to help the schools. I'm working to form a sort of pediatric and family medicine COVID response team. So if there are any cases, we'll be able to rapidly identify them and help guide the schools and the school nursing team. And then certainly public health. As I said, Dana's been in close touch, as has the rest of the team, to make sure that we're actively engaged and collaborate with the schools as they try and reopen. As far as the universities, there's also a fairly comprehensive New York State guidance about what safe opening would look like. And one of the things I want to emphasize is that there's the guidance, which in New York State, frankly, is much more prescriptive than what you see in other states. Testing was considered optional, but in conversations with all 4 of our universities, they've actually agreed to embark on what I would consider a very aggressive, robust testing program, really to prevent any students coming to the North Country with the illness. So students are being tested even prior to arrival, then they're being tested once they've come here, And then each of the universities has a surveillance testing program that's going to happen throughout the year. So I'm really excited that, again, they're going above and beyond what even New York State guidance says in order to have a safe reopening, both for their own interests, but also for the interests of the public health of the community. And then there will be significant modifications in travel. They've all changed their schedules. Sporting events and things like that are going to be substantially different or curtailed. And they've made all the same changes with their classroom and their environment. Also identified areas on campus to do quarantine. They really have comprehensive programs. And then finally, enforcement. They're well aware that in dealing with the age group who tends to go to college, that at times there will be opportunities for improvement in their compliance. And all 4 universities have clear plans to enforce these rules, and also plans for transition to online exclusively if that should be needed. So I just want to summarize by saying that, COVID clearly is a dangerous virus. It's causing severe disability and disease. It's moving across our country. Fortunately, the North Country largely has been spared, and I would argue that it has very much to do with the aggressive public health response that we saw when we identified those first cases in March. When I look back at them, I think it's entirely clear that if we hadn't had these public health measures in place, we would be dealing with not 250 or 260 cases, but potentially thousands. I do think that any intentional distraction and diminishment of the seriousness of this pandemic really ends up being counterproductive and has grave consequences. We know we have the tools to mitigate the spread of this virus and the tools that can help us safely reopen both businesses, schools, and universities. Testing is a critical component of our response. It's a rapidly evolving technology. And even as I was preparing these slides, there's a 4th kind of testing, which looks like it's going to get FDA approval. That's both going to be rapid and accurate. So the next time I talk, I'll try not to bore you, but there may be a 4th type of testing I discuss. And treatment and vaccinations are already under development, and there's some signs of early progress. And then finally, I just want to emphasize that St. Lawrence County needs to continue to use what I would call our toolkit. So it's the 5 pillars of community response, extensive testing, the public health measures, really to prevent a second wave, to save lives and to save our economy. So that's my review.
Are there any questions? Mr. Forsythe.
Thank you. It's either for Dana or Dr. Williams. I believe you said around 2,500 people have been isolated and quarantined throughout this. And you also mentioned the antibody test picks up whether someone had it or not. Are they counted in the total? If someone was isolated early, has the antibody test, and was positive, shows signs they had it, are they counted in the number of virus cases?
Yeah, so the only cases, or the way we count a case, is through positive PCR testing. We don't use the antibody test to identify those who have been positive or not.
So what is the antibody test for if it's not to go towards, why would someone want to do the antibody test?
So it's really to know if you've had a prior exposure or not. So, if in the past you thought, gosh, I've been sick, I'm wondering if I've been exposed, people do get the test. It did help us a few months back to know what the infection rate was, so we could kind of see who had been exposed and what was going on here in the North Country region.
One more.
Go ahead.
If you had a best case scenario guess, what percentage of people that were isolated or quarantined would you say had it but aren't on the list of positive cases?
Dr. Williams, from the study you guys did with the antibody testing, what was the percentage of people who were exposed?
So when we did a small survey of about 600 individuals, and I believe we had a total of 3 who tested positive on the serologies. I should point out that that was done early in the, early on when this was happening, and that if we were to repeat a survey like that, which we might consider doing, I suspect we would have a different number. But at least when we did the original survey, it was, again, like 3 out of 600. And to be honest with you, that was despite many people saying, I had a flu-like illness with no other explanation. I think many people thought they would test positive, but they didn't.
I'd just be curious if they do it later, what the actual was. Thank you.
Mr. Denisha.
Thank you, Mr. Chairman. This question would be for either Dr. McGuire or Dr. Williams. It's in regards to neck gaiters versus masks. I see a lot of people, and I'll reference, my reference is yesterday evening, watching a baseball game. And most of the folks were wearing neck gaiters that they could pull up over their nose and mouth. What's your opinion on which is better, please?
Dana gets all the difficult questions, so Dana, you're on.
Well, so, the guidance is to wear a cloth face covering. I would say the recommendation would be the one that you have to touch as least as possible, and that you're able to take it on and off without touching the mask area the most. So one with ear loops and things like that, does make it so, if you're wearing the one that's around the neck and you're constantly putting it up and down and kind of touching the whole thing, you should really try to not touch your face, not touch the mask area as much as possible.
Okay.
Mr. Burke?
Thank you.
Dr. Williams, you mentioned convalescent plasma. Is there an adequate supply of that? And if not, would the antibody testing might produce more or might help to secure more? And I have another question too, but.
Sure, well, that's a good question. And as I said, and this gets back to a previous question, one of the reasons to do the serologic testing is some people may be candidates to donate blood, which can then be turned into convalescent plasma. And so yes, so that is one reason to do the serologic testing. There's other steps that would be involved to actually become a donor, but certainly the first step would be to document that one had been exposed through the serologic testing.
And I guess the other part of that question, Doctor, is there an adequate supply of the convalescent plasma?
So I believe the answer to that is there is not an adequate supply, and I can try and be in touch with the American Red Cross, who I think would be the folks who would be most able to answer that question. I'll see if I can get some more information.
One further question: when the children go back to school, do you know they are to wear masks plus social distancing when inside the classrooms, inside the school? Is that your understanding, or is that the plan?
Yeah, I mean, so the guidance is a little bit vague. There's some discussion about during instruction, like the times that they may not need to wear a mask according to the guidance is it says during instruction, which I haven't been in primary or secondary school for a while, but I believe most of the day is instruction. I actually would say that from the experience that we've had, that the kids will do better if they just wear a mask when they're inside or outside, not socially or not physically distanced. I think the idea of kids taking their masks on and off all day because they're maybe 6 feet away from somebody momentarily is not a good idea. And I would advocate that for children who are able to do this, they should be wearing their masks except during lunch or during a designated break.
Thank you. Thank you.
Mr. Arquette.
Thank you, Mr. Chairman. The doctors, I think for me and many other people, that the the pandemic is a two-phase dilemma in which, you know, the economic suffering to some equals the health and safety suffering. And I like the inclusion of the financial aspect of it in this latest report. And I also like the fact that, you know, things like education that serve such a purpose beyond the economics are doable. It seems doable in your opinion, as long as we adhere to the advice of the experts that have continually drawn data. So I appreciate that part. But my question is, I'm assuming that we have laboratories in every corner of the globe that are pursuing a vaccine. Is there any optimism around a vaccine, in your opinions?
Yes, I think carefully combing the national and international medical literature on this, there seems to be a tremendous effort to make this happen and to make this happen quickly. A challenge with vaccines, of course, especially a vaccine that would be administered on such a large scale, and unlike vaccines like for shingles that are only given to a certain age group, this is a vaccine that presumably would be given to anyone who'd be agreeable to have it, no matter what the age. I think the importance of safety is just critical, and so I think there's reason for optimism. I think there'll be vaccine available soon, but how you define soon is your choice.
Right. I'll just follow up by saying, when we get to the other side of this terrible dilemma, I'll look forward to seeing you playing that guitar on that nice chair that's behind you there. Thank you very much.
Thank you. Any other questions? Seeing none. Thank you, doctors. We appreciate it. Very informative, and we don't like the topic, but we certainly like hearing from you. So,
thank you.
Thank you.
Now is the time for communications.
A thank you card was received from Sydney Jarvis of Norway Norfolk Central School, thanking the board for the Capital District Contract Betting Scholarship of $250. Sydney will be attending Clarkson University in the fall.
Thank you. Any citizen wanting to address the board is asked to stand at the microphone during the time they address the board. The address will be limited to a time of 5 minutes. Please state your name before beginning your address. Is there anybody in the audience or anybody on Zoom that wishes to address the board? Seeing none, we will move on to the presentation of resolutions by Mr. Sheridan.
Mr. Chairman, I have a resolution authorizing the chair to sign a contract with Health Research HRI for COVID-19 response and modifying the 2020 budget for the Public Health Department, and I move for its adoption.
Is there a second? Ms. Curran. Is there any discussion? Yeah, is that your hand up, Mr. Burke? You're muted. I guess not. Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Sheridan?
Mr. Chairman, I have a resolution proclaiming August.
Wait, just a second.
Is that a roll call?
No. Is it supposed to be a roll call?
Modifying is the word probably should be.
Yes, second part. Yes, I apologize, it's not marked.
Okay. This will have to be a roll call vote, the resolution that we just had. So let's call the roll, please.
Perkins,
Yes.
Akers,
Yes.
Bay,
Yes.
Haggard,
Yes.
Piatto,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran. Yes. Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Tanisha,
Yes.
15 yes.
Resolution is carried. Mr. Sheridan?
Mr. Chairman, I have a resolution proclaiming August as National Immunization Awareness Month, and I move for its adoption.
Is there a second? By Mr. Denisha and Ms. Curran. and Ms. Terminelli. Any discussion? Mr. Reagan, did you have your hand up? Seeing none, all in favor?
Aye.
Any opposed? Carried. Mr. Sheridan.
Chairman, I have a resolution authorizing the chair to sign a contract with Hillside Children's Center for recruitment of adopted families with children in foster care, and I move for its adoption.
Seconded by Mr. Forsythe, Ms. Curran, and Ms. Terminelli. Is there any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Denisha.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with North Country Housing Council Incorporated for the delivery of the countywide housing rehabilitation program round 3, move for its adoption.
Yes, seconded by Mr. Akers and Ms. Terminelli. Any discussion? Seeing none, all in favor? Opposed? Carried. Mr. Denisha.
Mr. Chairman, I offer a resolution reauthorizing the North Country Home Consortium with the counties of Jefferson and Lewis for the purpose of obtaining home investment partnership program funds from the U.S. Department of Housing and Urban Development, and move for its adoption.
Is there a second?
Second.
Ms. Curran and Mr. Sheridan. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the forgiveness of interest, penalties, and fees on a certain parcel of land to be obtained by the town of Louisville. I move this resolution.
Seconded by Mr. Forsythe and Mr. Arquette. Any discussion? Mr. Akers.
I had to introduce this resolution because I'm the finance chair, but I will not be supporting it. The reasons for this is that the town of Louisville would like these $900 in fees and interest excluded from the purchase of this property. I believe they took on the property, they didn't allow this to go to the tax sale. They entered into a business agreement with the owner of this property, and therefore these fees are part of the purchase price. The argument made by the city attorney, Eric Jefferson, said that there were line of sight issues and that the debris and clutter of this parcel would interfere with playground activities. I'm familiar with this area. The woods of this lot that the town of Louisville is interested in purchasing is about a quarter of a mile away from the ball fields. Also, Route 39 is, County Route 39 is of limited traffic. And if indeed there are line of sight issues on the side road that enters on to Route 39, that they can easily pare back the trees further than there are now. I will not be supporting this. We've had a policy of municipalities that we did this in Rick Perkins in Parrishville. He had a property that the municipality wanted. We enforced the rules. We made them pay the fees and interest. And I think we need to be consistent in asking and forcing the town of Louisville to do the same.
Mr. Arquette.
Thanks, Mr. Chairman. The leadership in the town of Louisville represented a health concern. Mr. Akers just described it as a low traffic area. It only takes one car. I'll be supporting the resolution.
Thank you. Anyone else? Mr.
Ask
Akers?
for a roll call, Mr. Chairman.
Roll call, please.
Akers,
No.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran. No. Reagan,
No.
Forsythe,
No.
Lightfoot,
No.
Sheridan,
No.
Smithers,
No.
Denisha,
Yes.
Perkins,
No.
7 yes, 8 no.
The resolution fails. Mr. Akers.
Thank you, Mr. Chairman. I offer a resolution for the workers' compensation self-insurance apportionment for the year 2021 and move this resolution.
Is there a second by Mr. Forsythe and Ms. Curran? Is there any discussion? Mr. Reagan?
I just wanted to be added as a second.
So noted. Any discussion? Roll call, please.
Hay,
Yes.
Hager,
Yes.
Piafko,
Yes.
Burke,
Yes.
Hartwick,
Yes.
Terminelli,
Yes.
Curran. Yes. Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
15 yes.
Resolution is passed. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign an agreement with New York Power Authority for installation of a culvert on Route 39 to facilitate Smart Path Moses Adirondack Transmission Lines project and to modify the 2020 budget for the Department of Highways. I move this resolution.
Is there a second by Mr. Forsythe? I'd like to recognize Mr. Chambers at this time to address this resolution.
Yes, thank you, Mr. Lightfoot. If I could ask this resolution to be tabled to next month, I would appreciate it. The Power Authority has requested, maybe looking at another way to address the wildlife that this culvert was going to address. And therefore, this culvert may not be needed. But another month would give us the time to maybe figure out if the DEC or the NIPA will actually need this culvert for a crossing.
Thank you. Mr. Arquette.
Thank you, Mr. Chairman. I'd like to abstain from conversation and recuse myself from voting.
So noted. Mr. Akers,
I would move to table this resolution.
is there a second? Seconded by Ms. Curran, Mr. Perkins, Mr. Denisha, Mr. Forsythe, Mr. Reagan, and Mr. Akers, and Mr. Fay. Mr. Sheridan. Any discussion on tabling the resolution? Until the next Finance Committee meeting, Mr. Chambers?
That would be fine, sir.
All right,
Yes.
okay. All in favor?
Aye.
Any opposed? The resolution is tabled. Mr. Akers.
Mr. Chairman, I offer a resolution approving a supplemental agreement number 2 with McFarland Johnson for additional services for the South Shore Road Bridge over the Oswegatchie River, bid number 3340-940, pin number 775371, and move this resolution.
Is there a second by Mr. Denisha and Mr. Reagan? Any discussion? Ms. Kerr?
It's a $15,000 change order. Is it just part of the job?
Chambers still.
Go ahead, Mr. Chambers.
Thank you.
Yes, primarily this is due to an issue with the one of the abutments. The boring for finding the bedrock gave us an elevation. However, the bedrock, instead of being relatively level, was on approximately a 45-degree angle. and needed to redesign the footing for the bridge. So it's a change order necessary for the project, but will still maintain the project budget, and it will be funded 95% by the federal and state government.
Thank you.
Thank you. Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2020 solid waste department budget for overtime. I move this resolution.
Is there a second? By Ms. Curran. And Mr. Arquette. Any discussion? Seeing none, roll call, please.
Hager,
Yes.
Diaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran. Yes. Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Tanisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Bay,
Yes.
15 yes.
Resolution is carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Northern Lights Healthcare Partnership, Inc. for home care services in the expanded in-home services for the elderly program. I move this resolution.
Is there a second? By Mr. Forsythe and Ms. Haggard. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I proudly offer this resolution in opposition to New York Senate Bill 8676 and Assembly 10780, which would require police officers to maintain private liability insurance and exclude police officers from provisions provided defense and indemnification. I move this resolution.
Seconded by Mr. Forsythe, Mr. Sheridan, Mr. Smithers, Mr. Denisha, Ms. Curran, and Mr. Perkins. Mr. Reagan. And you want to make a comment, Tony? Are you seconding? Seconding? Okay. And Mr. Arquette. Is there any discussion? Mr. Smithers.
In regard to Watertown Times editorial last Friday, which I believe is a mischaracterization of our intent and contains factual errors, I feel like I need to defend this body and our position on this. They say changes are necessary. St. Lawrence legislators should embrace reforms for policing and call our views short-sighted. I'm not sure if they even read the resolutions. They seem to be getting their information from a story published by the Courier Observer, and they say some lawmakers approved the resolution. I think they missed some of the whereases, and so in defense or to explain this, I offer the following. I don't know if they'll pay attention to me or not, but I don't know who wrote it because their names aren't attached, some editors, but I believe they misunderstood our purpose of these two resolutions. We heard from our sheriff as he detailed the changes and procedures currently being reviewed, as well as his expression of current feelings of employment as a law enforcement officer. We've seen and heard as police are being physically and verbally assaulted across our nation. None would disagree that individuals who commit crimes should be prosecuted and not immune from punishment. We currently have in this county a large physical and financial commitment to social services. I say that because we suggest taking money from the police and beefing up social services. And are we going to sit idly by while some legislators in Albany want to require law enforcement officers to carry private liability insurance, who then might be next to be held personally liable in performance of their job. I don't believe it's this body that's being short-sighted, and encourage us to remain united in support of these two resolutions.
Thank you, Mr. Smithers. Anyone else?
Mr. Chairman,
Mr. Sheridan, go ahead.
Mr. Chairman, I'll be in favor of Mr. Akers' resolution opposing this New York State's the Assembly bills that would exclude law enforcement, that would exclude law enforcement officers from the qualified immunity doctrine. Having experienced 25 years with the New York State Department of Corrections, with 19 years in the supervisory position, I've seen more than my fair share of frivolous lawsuits on staff. The cost to the state taxpayer that I retired 12 years ago, so I say it was enormous. The cost of the state taxpayers is enormous, and a lot of expense to deal with these lawsuits. And our police officers in our local municipalities should not be burdened with that expense. Instead of mandating new headaches and problems for our police, we should be proud and thankful for the people that are in law enforcement who put themselves in danger for us every day. And every day they go off to work, at any given time they may be faced with making life and death split-second decisions in order to protect their own safety or for others. So none of them are getting rich that I know of. So with all that's going on now with the violence and sensationalism we have seen recently on TV, we should have their backs like they've had our backs for an awful long time. So I'll be supporting this resolution. I also believe that this resolution would be something that would discourage people from embarking on a career in police work as well. So I'll be voting for it.
Thank you, Mr. Sheridan. Mr. Akers.
Thank you, Mr. Chairman. I think Mr. Sheridan and Mr. Smithers covered what I was going to bring up, and I thank them for their support.
You're welcome. Anyone else? If I, go ahead, Mr. Akers.
I just want to echo some of what Mr. Smithers said. The idea that the editorial board at the Watertown Times would criticize this body for its position on this particular legislation is very surprising and disappointing to me. As someone who spent their career writing editorials, the idea that a major publication in Northern New York would be in support of this kind of legislation is very disappointing. And I think it's important that the public understand that no one in this room is against legitimate reforms that improve the ability of our law enforcement community to protect and serve the people of the North Country. But the idea of no longer defending our law enforcement community when they are sued would hamstring their ability to function, because as Mr. Sheridan has said, it is not unusual for frivolous lawsuits to be filed against them, and there are current procedures in place to ensure that when citizens have questions or have complaints or decide to sue, the cases are reviewed and the courts can be very stiff in their punishments of communities that are not vigilant about ensuring that their law enforcement officers toe the line. And this kind of legislation simply would discourage people from becoming law enforcement officers and from putting their lives on the line to protect our communities. And the idea of requiring law enforcement to get private liability insurance is just outrageous and illustrates a lack of understanding of how law enforcement works and a lack of understanding of what we as communities need to be doing in order to have active law enforcement agencies that are willing, whose members are willing to protect our community. So thank you, Mr. Chairman, and thank you, Mr. Akers, for introducing this bill. And anytime that I or other am subject to criticism for supporting our law enforcement community, I'm more than happy to accept that criticism.
Thank you. Anyone else? Ms. Hager.
Thank you, Mr. Chairman. I'd like to say that I am also going to support this resolution. That being said, I believe that addressing reforms and social justice and supporting our local law enforcement in our county and in the state, shout out to the Potsdam Police Department, by the way, are not mutually exclusive. Thank you.
Anyone else? You know, much like what we've seen some of these demonstrations do to the people that are performing them, the rioting, the property damage, the fires, the bricks, the slingshots, and all of this stuff that goes along with it, really detracts from the message that Black Lives Matter wanted to get out when this started. Their feelings towards a black man who was essentially killed while in the hands of a police department. I think that they make themselves look rather cheap, rather ridiculous. I would bet that half of the people that are doing the rioting now don't have any idea the name of that man. And I think that the Watertown Times has taken a little dip in a cesspool by coming up with an editorial critical of what this board saw fit to profess, and that is their support for the police in New York, in St. Lawrence County, all of the police that we deal with. Now, I will grant you that I've certainly seen some things in my time that warrant an adverse reaction to some police procedures. By and large, those are so far in the minority, they wouldn't register if you asked for a percent of complaints that people make as a result of everyday contacts with police. And look at it this way. When are the police called? When somebody needs them, when somebody's in trouble, when somebody's had an accident, when somebody gets assaulted, when somebody's house gets broken into, when somebody gets raped. That's when the police are called. Those are not great circumstances. Add that to the family complaints that they get called to. And I can tell you, those are the worst to go to. So I'm really a little bit more than upset. I'm troubled by the Watertown Times putting this kind of tripe in its newspaper. And that's probably one of the reasons why I don't subscribe to it, because I don't like reading this crap. Thank you. Anyone else? Mr. Burke.
Well, I certainly agree with you, Joe, that it's a small percentage of police that give the whole effort a bad name. But I guess I would also say that it's a small percentage of protesters who give a bad name to all of them. And again, you know, I think about the stop and frisk in New York City. You know, I mean, how would it be how would it be like to be a black man walking in New York City and not sure you can walk 2 blocks without being stopped and frisked? And I know it's over, but I'm going to tell you, we need to have a sensitivity to the bigger picture. We're extremely fortunate in Northern New York to have what I believe is a great police presence. But I don't know that we should. I don't know that that gives us reason to be insensitive to all the protesters that see it differently. Thank you.
Mr. Arquette.
Thank you, Mr. Chairman. I'll be supporting this resolution because my priority is representing St. Lawrence County. And although that is our task, if we have a message that our constituents want to be sent nationally or at the state level through us, I believe that that's our responsibility as well. But I've received no indication from the people that I represent to send that message. So I think this once again represents legislation that is non-applicable for St. Lawrence County. And I appreciate all that our law enforcement folks do for us here in the North Country. Thank you.
Thank you, Mr. Arquette. Anyone else? Mr. Reagan.
I just want to emphasize that the individuals who have participated in the Black Lives Matter rallies and marches in St. Lawrence County are to be commended for the way they have acted during those events. I think they have sent a message of their concerns, the way that the founders of this country intended. They've been a great example to others around the country of the right way to make their views known to the public and to the government. And I think all of us in this room appreciate, you know, the right of the public to make its views known and to exercise their First Amendment rights. And I think that our criticism of this legislation has nothing to do with our views on peaceful protest.
Thank you, Mr. Reagan. Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I proudly offer a resolution discouraging local units of government from defunding or abolishing their police departments. I move this resolution.
Your second. Seconded by Ms. Curran, Mr. Perkin, Mr. Denisha, Mr. Sheridan, Mr. Forsythe, Mr. Reagan, and Mr. Arquette. Any discussion? Prior to the vote, I would like to be added to this as a co-sponsor as well as the last resolution. Mr. Denisha?
As would I, Mr. Chairman.
As would Mr. Denisha. Is there any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2020 budget for the County Administrator's Office for costs associated with the court-ordered services at New York State operating inpatient mental hygiene facilities. I move this resolution.
Is there a second? Ms. Curran and Mr. Perkins. Any discussion?
Yes.
Mr. Akers.
Just want to point out, as the county administrator has pointed out to us, that this is a shifting of a mandated cost that was shared by the state. It's now it's going to have to be 100% locally funded. It's a cost shift from Albany to us.
Mr. Denisha?
Thank you, Mr. Chairman. Just to echo Mr. Akers, this is just another unfunded mandate that's passed down to us from Albany. It's like the AIM funding. Albany eliminated the AIM funding from Albany budget, but saw to it that the counties had to pick up the cost. So this is just another shell game, shifting costs, and at the same time blaming local governments for being irresponsible. I will not support this.
Anyone else? Seeing none, roll call, please.
Diaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran. No. Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
No.
Sheridan,
No.
Smithers,
Yes.
Denisha,
No.
Perkins,
Yes.
Akers,
No.
Fay,
Yes.
Haggard,
Yes.
10 yes, 5 no.
Resolution is carried. Mr. Akers?
Mr. Chairman, I offer resolution amending resolution number 197-2013, extending the authorization of St. Lawrence County to impose an additional 1% of sales in compensating use taxes. I move this resolution.
There's a second. Ms. Curran, Mr. Perkins. Any discussion? Seeing none, all in favor? Oh, excuse me, Ms. Curran.
Can I be added as a co-sponsor, please?
We'll note that, yes. Anyone else? All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing the chair to sign a lease agreement with Patty Farley Stillman for space in the village of Governor at 99 West Main Street. I move this resolution.
Is there a second? By Ms. Curran? Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution adopting the local law for the year 2020 for setting salaries for the county employees. I move this resolution.
Is there a second? Second by Mr. Perkins and Ms. Curran and Mr. Arquette. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Perkins, would you present this resolution, please, the next one?
Thank you. Yes, Mr. Chairman. I have a resolution authorizing the filling of vacancies and move for its adoption.
Is there a second? By Mr. Akers and Ms. Curran. Any discussion? Mr. Burke?
This is the filling of all vacancies, right? That are listed here.
I'm sorry, could you repeat that, Mr. Burke?
We're on the agenda item that deals with the filling of about a dozen or so vacancies.
That's correct.
I have a question about one, the social services attorney. I see a 30-day wait. I'm going to repeat my concerns that I previously expressed at the last meeting. The fact that we are in a crisis mode, my opinion, with DSS Legal, we've had over 100% turnover in staff since last November. I believe we're at 50% staffing now, and I'm really concerned, and I would like I would like to know what we're doing to immediately fill these items, because there is a direct correlation to the health and safety of children in the county. The attorneys play a pivotal role in removing children from imminent danger, and it's not an item, or it's not a series of items that we can be complacent about. And it certainly begs the question, why is there such turnover in that department? What are the exit interviews saying? How many do we currently have in the queue for potential interview? I'm very concerned about this. And again, it's a crisis situation. And I don't, and then I look at 30, 60, 90 days. We're still delaying positions. We're sitting on $30 million in the fund balance. Yet we are prepared not to give the resources needed to protect the children of the county. All these items that are listed here, I'm assuming and believe all those items to be needed. They are part of the services that we are mandated to provide. Why are we still doing 30, 60, 90 days? Are we shooting for 35 million? If they're responsible. And I'd like some answers. I feel that this is very inappropriate. We are failing our core mission to provide quality services.
Mr. Akers,
I call the question.
is there a second by Mr. Forsythe and Ms. Curran? All in favor of calling the question?
Aye.
Any opposed?
Yes.
Yes.
2 opposed?
3.
3 opposed?
3 counts to pay.
Okay. 4 opposed? 5 opposed? Okay. Any opposed in this room?
Dan?
Dan? 6 opposed. 6 opposed, John. I would say this, is that a committee of legislators and
Question the discussion.
you're gonna interrupt me?
Robert's rules, I believe, indicates that a
Well,
call.
I will allow it. I'm just asking you,
And
you
then
want
it
to
ends.
interrupt what I'm saying? Go ahead. Go ahead, Tony.
No, there's no we've had a call to question. There's no discussion. That's what I
I
intervened.
understand that. Okay. All in favor of calling the question?
I already voted.
Already
We
did.
already voted. See,
So now we go on to the resolution.
right. And that's what I was speaking to, was the resolution. is
No, we
that-
don't go on. We don't go on to the resolution. You failed to get the 2/3 majority. Point of order. It requires a 2/3 majority to close the discussion.
I think that's correct.
Stand by.
Check it out.
Mr. Akers did that at the last meeting. It's not going
Hold
to be
off,
allowed.
hold off, John, until the county attorney renders a decision there.
Mr. Burke is correct. It will require 2/3.
Okay. All right, so it fails. Okay. And we will continue with whatever the debate is here. Mr. Arquette.
Thank you, Mr. Chairman. I think Mr. Burke brings up a very legitimate concern. We all know that we're financially stressed. We were stressed before the pandemic, and we all understand that. But I think with recent incidents that we realize that in that particular department that Mr. Burke is referencing, that we're extremely understaffed to the degree that I'm not certain that we're not understaffed below the mandated level by the state or federal government in that department. And the fact that that there's children out there that are not being taken care of properly is a strong concern. But even from a financial standpoint, if we continue on the path that we're heading in that particular department without staffing properly, there will be a financial consequence as well. And I think these concerns are legitimate. I think they need to be addressed immediately. And I think that's really what Mr. Burke was trying to exemplify. I appreciate the opportunity.
Thank you, Mr. Arquette. Mr. Fay.
I'm serving on the vacancy committee when this was passed, the timeline is 30 days. I think there's been some changes, I stand to be corrected, on responsibility of some social service attorneys. So basically, I believe this position should be filled immediately also.
Mr. Chair, can I speak to that?
County Administrator.
So the position in question on the resolution this evening was vacated on July 10th. So currently, I believe there are 4 applications pending. What we want to do by indicating the distance between the likelihood of the position being filled and the time that the position's gone vacant in the department since July 10th, the vacancy committee discussed, it's very likely that position approved tonight may or may not be filled by August 10th. So that would be 30 days that the department went without an attorney. And in all of these, when we look back at the date they became vacant, we seek to make sure the board's informed how many days that position's been vacant. So I believe they are recruiting. I believe a new attorney started today. I believe also another attorney finished at the latter part of last week. So I believe that there are efforts, and we continue to put efforts toward getting these positions filled. But we certainly, Mr. Burke can address these more specifically once the opportunity to review the applications and interview process is conducted.
Ms. Terminelli.
I have a question. I've been involved in the vacancy review process in the past, and at the meetings that I was at, it was the department head that brought forward the positions or the vacancies that they were requesting to fill. How does that work in a department that doesn't have a current department head or a commissioner in this case to bring those cases? So if when there's that gap in a leadership, how are those vacancies moved forward?
There's not a standard practice. If there is the ability for the department unit supervisor to come, sometimes that occurs. Sometimes they're unavailable. Sometimes I'll receive the information from department staff and provide that. There's a variety of ways. I wouldn't say there's one standard approach that's taken, but we do the best to get all the information before the committee.
So just to clarify, positions can still be moved forward through vacancy committee when we're lacking a department head or a supervisor?
Absolutely.
Is there anyone else that wishes to speak before I call on Mr. Burke again? Mr. Akers.
So I'll list Mrs. Doyle. So essentially, the 30 days would be up by the August 10th date, correct?
That's correct. It
7
can be
days.
filled the 11th.
Thank you very much.
Anyone else that hasn't spoken yet?
And I would also just add to that, the position that's most recently become vacant will not have to come back before you because it was not a permanent position. The provisional period was still underway. So that position will come back to me by vacancy and can be refilled without additional action of the board.
Mr. Burke.
Well, let me preface this by saying that I have tremendous respect for our staff, but I'm going to tell you that the response to the filling of these items has not been good. It has been over 9 months, and we've averaged about a 50% vacancy rate in our attorney staffing. That is not acceptable, especially when children's welfare is at stake. It's not acceptable. I don't care. I mean, forget to talk about the 30, 60, 90 days. We need somebody there tomorrow. And whatever it takes, I'm only one vote, but I can assure you, if you come back with a plan to say, I can get 3 more attorneys if we do this, I'll guarantee you'll have my support, and I believe you'll have the support of others. The consequences are too serious not to have a rapid response. And it is not a success story when we look at 9 months and averaging a 50% rate. And then I see on our vacancy thing, we've got a 90-day wait on the deputy commissioner. Once again, I mean, hopefully we'll be hiring a new commissioner, maybe tonight or whenever, and that commissioner, who is brand new, is going to need support, not 90 days from now. Those arbitrary numbers fail to address the needs and our core mission of providing good services.
Mr. Chair.
Is there anyone else? Mr. Forsythe.
Yeah, actually the 9th will be 30 days, I believe, 31 July. I have no problem pushing this resolution forward. I understand John's, I understand theoretically, but I don't think if you bring someone on tomorrow or last week, they're gonna be up to snuff to help the Department of Social Services, the new head, in any meaningful way that I'm aware of. There's gotta be a learning curve of some sort. I think we're making a lot out of 5 or 6 days. I'm ready to vote on this tonight and move down to the next door.
County Administrator.
To clarify, the deputy commissioner has been vacant since March 31st, when the deputy moved into the commissioner position for an interim period. So that 90 days would have already been exceeded and could be filled as soon as they would like to hire.
Okay. Is there anyone else that hasn't spoken? Mr. Equat.
Thank you, Mr. Chairman. And again, I think that, you know, the urgency represents, and John had tried to indicate earlier, that whatever it takes to draw those people that are ready to go, and if it's higher scale wage level, then that's what needs to happen. And I think I want to remind everybody, my colleagues, taxpayers, anybody concerned with the cost, which we all should be, that these positions are highly reimbursable.
Thank you. Anyone else? Mr. Akers?
Just say that the vacancy committee, for all these positions over the years that we've been doing this and the renewal of the vacancy committee has been working quite well. There's usually 5 members in there. Rarely are there 3-2 votes. Usually it's unanimous. But you have the county administrator, you have the assistant county administrator, usually somebody, Stephanie or Johnny from payroll, and you have at least the attempt is made to have 2 legislators. The legislators rotate through. It isn't by party. It could be 2 Republicans, it could be 2 Democrats, it could be 1 of each. It has worked actually quite well. I think the immediate fill rate in the past year was in the upper 80%. That would be correct, County Administrator, Mrs. Doyle?
Yes, it was 89, I believe.
89%. So this board and this administration are not shirking their duty. They understand with the news and the, you know, we had a death in Governor, whether that's related to legal or maybe the lack of CPS or whatever, maybe mandates made by the state. But it's not a symbol of incompetency or delay or concern about money over the health of the children that we serve. So I want to thank Ruth Doyle for putting this, or urging this vacancy committee back into effect here. It's been going for 2 to 3, maybe 4 years now. Time flies. But I think that it's worked very well, so that at least a couple legislators are involved in the discussions in depth with the department head, and we're hearing proposals. So it's very rare that the department head is denied or delayed. Thank you.
Mr. Reagan?
I would just also like to point out to the public that it wasn't that long ago that this board has added 6 additional positions to assist social services in working on child protective cases. And, you know, we saw a problem and we hired the additional people to address that problem, because there was a problem in the caseloads, there was a problem in our ability to respond. And I think that the county appropriately added additional positions to help address that, and added positions directly involved in identifying families who are having serious problems and who have the power to take children out of dangerous situations. And you know, an additional 6 positions is a big increase in that very difficult job. So the county has been working overtime to address and fix our ability to make sure that when someone calls and says that there's a child in trouble, that we have people who are able to respond and get them out of danger. Thank you.
Thank you, Mr. Reagan. Anybody else? Anybody who hasn't spoken? Mr. Arquette.
Thank you, Mr. Chair. Mr. Akers and Mr. Reagan are both right in their assessments of what's transpired there. I'm not calling the procedure into question. I'm calling the need into question. We have a stronger need there than I think we were all aware. That's what's being called into question. By no means the process, by no means what's been happening over the last couple of years. It's the need that's been uncovered. Thank you.
Thank you. Mr. Burke?
Just one other thing to add on to Tony's comment. Nobody's faulting child protection workers. It requires to take a child out of imminent danger. It requires court action. It requires the coordination between child protective workers, the caseworkers, and the attorneys. So to say that we've added child protection workers, I commend the county for doing that. It was much needed, especially in view of the fact that we've gone from 155 to about 320 in the last 5 years for children in placement, 100% increase. So keep in mind that it's not just the child protection workers. The pivotal action is in the courts, in the removal, and that requires a sufficient legal staff. Thank you.
Thank you. I think we beat this horse enough tonight.
I called the question earlier.
Well, if there are no more questions, I would ask for the vote. I don't see any more hands go up. All those in favor of the resolution?
Aye.
Any opposed?
Can we have a roll call vote, please?
It's unanimous.
It's
unanimous.
I think you just had a unanimous vote in favor.
Sorry.
Is that okay with you? Thank you. The resolution passes. Mr. Akers.
Mr. Chairman, I offer a resolution appointing an interim St. Lawrence County historian. I move this resolution.
Is there a second? Second by Mr. Smithers, Ms. Curran, and Mr. Sheridan. There is a amendment to that resolution that requires a name, and if someone would offer the amendment, Nancy LaFavor. That's the one we're at? Yeah, all it is a name. Adding that to the resolution. Mr. Akers, seconded by Mr. Forsythe. Now we have a resolution with a name. All those in favor of the resolution with the name of Nancy LaFavor, signify by saying aye.
Aye.
Any opposed? Carried. Mr. Akers.
Thank you, Mr. Chairman. Mr. Chairman, I offer a resolution appointing the Commissioner of Social Services for St. Lawrence County. And I fill in the names of Cynthia Ackerman at a salary of $109,347.
Is there a second? Ms. Curran, Mr. Sheridan, and Mr. Forsythe. And excuse me, Ms. Haggard.
No,
She's abstaining.
You
I'm
got your
trying
hand
to
up.
recuse.
Margaret,
I'm
you got your hand
sorry.
up.
I'm sorry, Mr. Chairman. I was trying to recuse.
Okay.
Okay, sorry.
So we've got a motion on the floor. It's been seconded. Mr. Akers.
Mr. Chairman, I'd like to add an amendment to this after the now therefore be it resolved. I would like to add, be it further resolved that upon a successful 6-month review by the county administrator, there will be a salary increase to band 7, step 8.
Is there a second to that amendment by Mr. Forsythe, Ms. Curran, Ms. Terminelli? Any discussion as to the amendment? Seeing none, all in favor?
Aye.
Opposed? Carried. The amendment is carried. Back to the resolution. Is Mr. Reagan?
Mr. Chairman, can we ask the county administrator to explain to the public a little bit about the credentials of the proposed Commissioner of Social Services?
County Administrator?
I don't have my folder in front of me, I apologize. Ms. Ackerman is coming to us from the ARC of Jefferson and St. Lawrence. She has been with them, I believe, for the better part of 17 years. Certainly can provide you with more information. And we shared the resume with you on Google Drive today. She has background in areas of disabilities and also the populations that's well served by the housing programs that the ARC provides. That's what she oversees at this time. She has over 200 employees, I believe, and oversees a variety of programs between both Jefferson County and St. Lawrence County.
Go ahead.
And could you share that resume with the press as well? And I think I'd like to commend the search committee. This is a difficult position to fill. And the Mrs. Ackerman brings a great deal of expertise in working with many kinds of people and a vast area, and I think she brings a lot of strengths to us, and I just want to congratulate the search committee on their efforts.
Thank you, Mr. Reagan. Mr. Forsythe?
Yeah, I'd like to reiterate, I was on the search committee. Ms. Ackerman did very well, had a very good resume. MBA also, I believe she had. Anyone that would want to take this job in this trying times, God bless you. I think she'll do a wonderful job, and that just shows me her leadership style. So I look forward to her taking the role on, and I wish her the best of luck.
Mr. Terminelli?
I wanted to thank the search committee for their work on this. I know it was difficult and you had several candidates to look at. I just have a question. In the past, when we've brought on department heads, they've sometimes had a 1-year probationary period, and I see that the term of this appointment is for 5 years. Is there a 1-year probationary period, or is it just the 6 months and the step increase on the salary?
The term is by appointment, but the probationary period is between 2 and 12 months.
Anyone else?
If I could just mention her timeline for arrival.
Go ahead.
So Mrs. Ackerman will finish her work at the ARC of Jefferson and St. Lawrence on Friday, and she will be joining us on Monday, August 17th. She will be stopping by tomorrow afternoon to have a tour of the facility and hopefully meet and greet some staff. She's very eager to get started, should she be appointed.
Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Denisha?
Mr. Chairman, I offer a resolution setting a date for a public hearing on proposed local law B, number to be determined, for the year 2020, and then local law D for the year 2018. To setting policy on acquisition and sale of tax delinquent property in San Juan County. Move its adoption.
Is there a second? Second by Ms. Curran. And Ms. Terminelli. Any discussion? Mr. Denisha?
Yeah, just briefly, Mr. Chairman, I think this is this helps to address one of the issues that I believe that certain folks have had in the county. And so it, while it's, it's not perfect, it's, I believe it's a good, I think it's a good compromise.
Thank you. Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. County Administrator's report.
So
So I'll start with a brief COVID-19 update. We are, as an enforcement team, up to 575 complaints through the New York on pause. I would say we're probably tipping close to 600 when you count the ones that reported to you that are now coming through our new website and or phone calls received by any of the offices of the members of the team. So we're doing our best to respond to those. We have seen a dramatic decrease in the big box retailers, I believe they're referred to, the Walmarts and Lowe's. We are seeing more focused on mask wearing of individuals entering and leaving establishments, social distancing, certainly being the summertime gatherings that we are told about prior to the occurrence of those makes it a little bit challenging, but also responding to when we have a name provided, often complaints come through anonymous. We are responding to those and making contact when necessary. To date, we have not initiated any fines, and we continue, as we had reported previously, that after 2 complaints, we are sending a communication, and after 3, we are sending one of the sheriff's deputies out to make contact, to educate and to raise awareness. We probably have seen the most steady timeline now in the last few weeks of things not changing again, requirements not increasing. So that's given folks ample opportunity, I think, to respond, to make sure that folks coming in and leaving. I have it in one of the stores in Potsdam, walked in, I had my mask on, the clerks had theirs on, someone walked in without one, they were promptly asked, left the store, came back with their mask. So we're hearing stories like that of folks enforcing measures that are required by New York State at this time. As just a precursor of what we're seeing over the weekend, last weekend we saw 28 from Friday until Sunday evening. This weekend we saw 16. So a little bit of a decrease there. I did want to mention and kind of follow on to Dr. Williams' statement earlier about the schools and the plans that the schools have submitted to New York State for consideration. As you might imagine, a large number of county staff have school-age children. And I think that it's going to be important currently, as a parent of school-age children myself, it creates a great deal of anxiety and stress, anticipating what will be the schedule for our children. So what I'd like to do, once those plans have been approved, I would like to assemble a committee, small committee of staff to take a look at these issues. We shouldn't force our employees to choose between being a parent and being an employee, and figure out a way. Certainly daycare in St. Lawrence County was a struggle prior to COVID-19. Now it's going to be an even greater demand, and the requirements to have daycare are going to be even greater. So the struggle that's coming to us in the next 4 to 5 weeks is going to be quite a challenge, and I would like to be able to bring back to you some options to consider. We continue to work in somewhat of a flexible work environment to maintain those densities at a safe level. We have completed the modifications necessary between staff and both directional and as far as the limiting the contact, place plexiglass in place, things of that nature. That's all completed. But I think this is a different challenge for our staff as we head into the next few months and school begins, and the challenges that we face with scheduling. It's going to be place great demand on our staff. So I would like to bring you some information on that, and also an understanding of what that might look like so that the board can make a determination. Next, I would mention that vacancy review is scheduled for tomorrow at 1 p.m. There are 12 positions to be considered. There are 3 that are abolish and create positions. There are 3 temporary positions to be considered, as well as 8 departments that are represented. And one of the things that I both like to keep our department heads apprised of, as well as the board, is at any given time per month what we look at for vacancies. And currently, out of our 806 positions, excluding the temporary positions, there are 58 positions that either are in the process of, perhaps may not be vacant quite yet, but are being considered for review and potential fill, or some version of that. So that committee will meet at 1 o'clock tomorrow. Legislators Burke and Terminelli will be joining us. I do believe that this will be one of the most challenging budget years, not unlike 2016 when I took over as administrator. We begin budget reviews in earnest tomorrow with departments. You may recall at Finance Committee in June, I mentioned to you we were changing the budget schedule as far as the meetings with the budget team. On a weekly basis, we're going to determine if it's safe to meet in person or meet much like this environment on Zoom. We're going to start the budget reviews on Zoom with the departments coming in, much like you see at committee. And on a weekly basis, take a look at that, take a look at our numbers. We're very fortunate at this time to only have had 2 cases very early on county staff, but we certainly would want to increase the opportunity for the budget team to become symptomatic and or any of our departments. So being sensitive to that, I think that it's going to be a challenge for us because a lot of the dialogue and debate that occurs by being in person is very different when you're on a Zoom environment, things that you may think of or think to have a discussion about. So we're going to try it, but it's going to be a fluid process. I do, as I always have, invite all of you. The schedule will be posted on Google Drive if you'd like to attend any particular department or all of them. We can send you the Zoom invite, or you're welcome to stop in. We can make arrangements to make sure you have access to those conversations. So those will begin tomorrow, and those will go through August 27th for the first round of all the departments coming in to meet with the budget team. And then we begin the process of review, which may require additional conversations with departments, as it typically does, and then we'll begin putting the documents together so that I can present the tentative budget for 2021. I wanted to give you an update on 2 areas that we'd like to bring to you, most likely in the budget, because we're overdue in bringing you a response. If you recall, in November of 2019, there was an immediate decision the board had to make about taking over the Canton location for the nutrition center and the services that were provided at the high rise. So when that, and the board provided support to take that over, and it's gone extremely well. One of the things we talked about was taking a 6-month review of nutrition sites. Now that's all been turned upside down because of COVID and the closure associated with nutrition sites. But I think looking forward into the budget for 2021, those conversations are important. And certainly we've seen a dramatic increase, Larry can attest to it, of home delivered meals. And so that also needs to be funded because folks are in need and those services need to be provided. We aren't hearing at this time that there's any compromise to the Office for the Aging funding levels, but we certainly, as all departments are, watching those very closely. The other thing that I just wanted to mention, again, slightly overdue and coming back to you on, is the discovery reforms. You were courteous to provide 3 positions to the Departments of Emergency Services, the Sheriff's Department, and the District Attorney's Office at the beginning of the year in anticipation of dramatic change. Well, the court shut down due to COVID, so we haven't really been able to measure that as we suspected when we requested the positions. The positions are filled, but we'd like to be able to give you an update on what those numbers look like, on the turnaround time, and verse you in what that looks like for St. Lawrence County. And also looking forward to what 2021 looks like if those positions, as the courts begin to reopen and as the work begins to increase again at the local court level, will look like. So we'd like to bring those to you as well. You were kind enough last week when I requested to be able to provide the city of Ogdensburg with some assistance they needed with their assessments and getting their tax rolls ready. Well, that has been through great work of the Real Property Tax Department, the Real Property Tax Services aides they have and the staff in that department have completed the task. They had it ready for Mark Schnorr, who I believe is also the Town of Oshkosh assessor, who is assisting the city of Ogdensburg through the end of September. He was able to pick up the roll on Friday afternoon, and we were able to complete the work that otherwise would have made great delays, as I laid out for you, for the county. We will provide them with a bill. I will bring you a resolution to sign an agreement with them for the services that were provided and be able to accept that revenue associated with the work completed. So certainly very proud of the remarkable work done by our county staff, and we continue to work on things like sales tax and the other areas of requests they've made, and we'll be talking about those as we prepare the budget. If you recall, last week, we talked a little bit about the Marine Sanctuary and the opportunity to have our Oswego County Administrator Philip Church, as well as NOAA Representative Ellen Brody join us. And it would probably be most beneficial if either chair would provide, and the board is willing, to have them come to the Operations or Services meeting. And I say that because at Finance this month, we'll have a visit from our auditors who have closed the audit a month early. And so they'd like to meet with the audit committee before Finance and then report to you. So I wanted to ask for feedback with that before I continue.
Any comments?
Can we take the?
Everybody's all talked out.
I guess. Or asleep.
Go for it.
You're a big talk.
Mr. Forsythe.
Is there gonna be time limits imposed on both, or? is it
I would
gonna be a
accept
law?
certainly holding to our 10 minutes or 15 with questions.
Or 15.
Go ahead.
Just, Mr. Chairman, just to suggest that we are going to have it services or operations, I'm not sure which one's first, but that we have at the whichever committee meeting happens to be first on the agenda.
Is there any objection to inviting them to come?
Not a bit.
All right, so we'll make that plan. One of the areas that you're well aware has been also delayed due to COVID is the census and our ability to get out and encourage folks to report on the census. Word was received today that the grant that we had budgeted for and planned on has been reduced by half, and that a new plan will be required within a week. So planning staff has been seriously working on amending. It will not provide for staff, but what it will provide for is them an opportunity at least to see some funding to increase the opportunity to get folks reporting. We have worked with Highway Department, and you may see them out and about over the next few weeks to month, gotten the signs out that Don can spare to encourage folks in low reporting communities to report their census. So that I think was welcome news because it's something, but of course disappointing that it isn't all the funding that was expected. And then lastly, I wanted just to give you a quick update on NISAC. As many of you know, NISAC has canceled their in-person fall conference, which is typically in September. And unfortunately for us, it was going to be in Lake Placid, so our travel expenses would also be reduced. Nonetheless, they're going to host their standing committees, which many of you either attend or participate on, virtually over the next 2 weeks. And once adopted, I'll go over what the subject matter is. I'll share those resolutions with you. If you recall, I'm serving this year as the chair of the Standing Committee on Taxation and Finance for NISAC. We're meeting tomorrow afternoon, and we'll consider a few resolutions. One on directing federal aid to support COVID-19 response and recovery, as well as requesting that there be an end to the practice of diverting local sales tax to supplant state responsibilities. I also serve on the Intergovernmental Affairs Committee, and our neighbor to the west, Bob Heckman in Jefferson County, serves as the chair of that committee. They'll consider 3 resolutions, the first being rebuilding government, a commission they're requesting to identify cost savings, preservation of local services without additional cost to local taxpayers. Also looking for additional communication support for the Board of Elections, related to providing guidance to them and encouraging a stronger voter turnout. And then lastly, the last resolution they'll consider is an increase to the community college's support provided. So those are the areas. If you're interested in that schedule or popping in to attend any of those standing committees like you would in person, let me know. And certainly we can get those arrangements and find out when those meetings are being held. And that's all I have unless there's questions.
Any questions? No questions.
Thank you.
Are there any committee reports? Rita, Curran.
I heard from Walt Hall today, the fishing and fishing advisories board, Walt Hall. So he sent us a few articles on the marine sanctuary proposal. I'm going to get a copy out to all of you.
Thank you. Anyone else? Seeing none, is there any old business?
Yes.
Ms. Terminelli.
It's a little old and a little new. It's kind of tied into both. I have some questions and would like to request some clarification on ethics opinions, especially the one that was requested in regards to Legislator Haggard. May I direct some questions to the county attorney?
Certainly.
Thank you. Mr. Button, I was under the impression that an ethics opinion was requested by an individual on behalf of themselves. Can you just clarify? I'm under the impression that Ms. Legislator Haggard just recently had an ethics opinion handed down to her that she didn't initiate. And I'm just wondering, is this a typical protocol or procedure to seek an ethics opinion on behalf of a colleague?
You can actually seek an ethics opinion on me. I don't know if you can hear me, Ms. Terminelli. Can you hear me?
Not great.
Is there a
Go to the
microphone? Can you hear me now?
Thank you. Yes, very much.
Yes, much better. Under our ethics local law, an advisory opinion may be requested by the individual regarding their proposed prospective behavior or the superior of an individual actually asking about the behavior of a subordinate or an individual for whom they are responsible for the performance of their work. So it is not just limited to the individual.
So a follow-up question to that. So we couldn't request an ethics opinion on one of our colleagues, but Mr. Lightfoot is considered a superior. Is that how that works?
Under county law, the chair is actually given complete oversight over all of the activities, the functions of the property, as well as the employees of the county. So that's correct.
Thank you.
Mr. Yacco.
Yeah, so I just have a couple questions. Who drafted each of the ethics opinions and what research served as a basis for each one?
Is that a question to me?
Is that for the county attorney?
Yes.
Ms. Bianco, I'm sorry, you're going to have to clarify for me.
Like who drafted each of the ethics opinions and what research served as a basis for each one?
If you're referring to advisory opinions that are confidential by law, you can speak to any individual that secured an advisory opinion, but I'm not permitted to actually speak to them.
Ms. Haggard.
Thank you, Mr. Chairman. Because the chairman of our board is chosen to make an ethics opinion about me public, I'd like to address it publicly. Before I took office as a county legislator, I sought an opinion from the County Ethics Board in regard to my husband, David Haggard, working in the Department of Social Services as general counsel. I received that opinion, and it prohibited me from participation in any discussion and voting on all matters regarding social services. I was further directed to announce such recusal publicly at my first meeting. I have diligently complied with that opinion in its entirety. You can imagine my shock when I discovered Mr. Lightfoot had requested another ethics opinion with the intention of further restricting my ability to function as a legislator. After retaining outside counsel, and before you say anything, not David Haggard, in actuality, it does the opposite. Specifically delineates the 3 topics regarding David from which I need to recuse. Equally shocking was the description of my position as a subordinate to Mr. Lightfoot. Knowing this to be untrue and a gross misrepresentation of my role on the Board of Legislators, clearly he was advised by someone of this perceived loophole. It is now clear to me that this misrepresentation was used as an excuse to comply with County Ethics Law, Article 20, Number 1, limiting who can request an ethics opinion. I am not now, nor have ever been, and never will be a subordinate of Mr. Lightfoot. As I search for an underlying reason for this attack, I can't help but wonder if it's because I am a female, or my desire to speak out on issues of concern to our county, or perhaps a combination of both. I have a great desire to serve my constituents and the people of St. Lawrence County. I can work with opposing views, seeking to find common ground for the benefit of all county residents. I will, however, not tolerate bullying or any form of victimization against myself, my female colleagues, my constituents, or anyone in the county structure. This has the potential to create a hostile work environment. Respect should emulate from all county leadership. Mr. Lightfoot, those who blatantly disregard this core principle should be ashamed. Thank you.
Mr. Arquette.
Thank you, Mr. Chairman. I'll be honest with you, I was blindsided by your choice to pursue an ethical determination on Ms. Haggard after she'd already done that. And especially the fact that at a previous meeting, when that was called into question, our county attorney, who I have a great level of respect and belief in his findings, indicated that there was no wrongdoing, yet you continued on with that. We've just recently lost what I consider a couple very, very good legislators because of ethical decisions that I called into question publicly. You know, I'd like to hope that this was not retaliatory, was it?
Are you serious, Tony? Are you really
Very
serious
serious.
asking that question?
I think everybody here is very serious.
Well, what do you think, Tony?
I
You
believe
think
it
it was
was.
retaliatory?
I can
So
think of
no
no other
matter what I
reason
say, it isn't
after
gonna
the
change your
county
mind,
attorney
okay?
rendered his decision and you chose to do this.
Mr. Burke.
Well, as you've heard, Joe requested an ethics opinion on our colleague, Margaret Haggard. And as you've heard, an opinion had already been issued at her request before Margaret took office. That opinion prohibited her from any discussion regarding the Department of Social Services, which is the largest and one of the most, if not the most, consequential departments in the county. Furthermore, she needed to make public her intent to abstain from discussions relating to social services. And since this was an advisory opinion she requested, why did the disclosure have to be public? How can this confidential, and I want to emphasize confidential, because it's in our county ethics law, how can this confidential opinion be reconciled with the mandate for public disclosure upon taking office? What was the point in that? Margaret has faithfully complied with this mandate. So again, what was the purpose of making her state this publicly before or just immediately after she took office? Apparently, this rendering by the ethics committee didn't satisfy the chair. So he requested an additional opinion, which was granted under the guise of Margaret being his subordinate in a feeble attempt to comply with our ethics law, Article 20, number 1. Like Margaret, and I believe many of my colleagues, we all have the belief that we are one vote, equal standing, and we answer to our constituents. Joe Lightfoot has specific powers and the power to run the meetings, the power to make committee appointments, the power to declare emergencies. They are specific, but I would challenge Steve to produce that law that shows that we are his subordinates. But anyways, I'm going to continue. The opinion was given and the hatches tightened further on Margaret, placing additional restraints on her ability to represent her constituents. However, the opinion rendered by the Attorney General's office and used by the Ethics Committee as a basis for their most recent opinion, requested by Chair Lightfoot, provides great clarity for both ethics rulings on Margaret. According to the Attorney General's office, an elected official must recuse himself or herself from participating in matters affecting the compensation, employment, and other terms and conditions of employment of his or her spouse. We have expressed the view that a member of the legislative body may participate in other governmental matters relating to the operation of a municipal department in which her or his spouse serves, except ones in which the legislator has a personal interest by reasons of affinity. Simply said, unlike matters such as salary and conditions of employment of her spouse, she would not have personal interest in these matters requiring recusal. So, simply said, there is no reason for her to recuse herself from the discussions about social services. Her only obligation, according to the Attorney General's report used by the Ethics Committee in an attempt to further tighten the hatch, according to the Attorney General, the only time she has to recuse herself is when the salary and conditions of employment of her spouse are being discussed. That's the only time. And it begs the question of when I hear Tony or when I hear Nicole having to recuse themselves from discussions about the power authority, according to this, there's no reason to do that. Any of our discussions have nothing to do with their salary or conditions of employment. So the same legal reference by the Attorney General's office in attempt to restrict Margaret's attendance in executive session clearly demonstrates the significant flaws in the first and core opinion, effectively denying her the opportunity to fully represent her constituents. But rather than correct the first opinion, a choice was made to seek additional restrictions and further restrict her ability to represent her constituents. How could this happen? Does anyone look at the decisions of the Ethics Committee? How does the county attorney decide who his clients are? He is the attorney for the Ethics Committee. He is also our attorney. How does he decide who his clients are and who he's representing? Is there a conflict in representing both the Ethics Board and at the same time representing legislators who represent county residents? How did the misrepresentation of Margaret's position with regard to the chair occur? Is it not reasonable to believe that this was no accident and that describing her as a subordinate provided the rationale for the ethics request by the chair? How can we believe that there is an independent functioning of our ethics board? Article 4 of our ethics law states that the ethics code shall not prohibit or require recusal of an action lawfully undertaken pursuant to one's official duties. Yet, what would you call these actions that have been taken against Margaret? This is exactly what happened to Margaret. She sought and continues to seek only to serve the people of our county. She has never breached our ethics code and will always go the extra distance to assure transparency. So again, we must ask, what are the motives behind this apparent attack? How many legislators must we lose to this ethics process? We are extremely fortunate to have an individual who has a distinguished teaching background, an MBA, and years of experience as a judge. She has an acute awareness of our community's needs and is devoted and determined to address those needs. So I am asking, as a colleague and as a legislator, that this needs to be immediately remedied. The idea that we would use an extension or potentially use an extension of county government against one of our own legislators is unfathomable. And I am asking, and I would hope we all ask, that there is an immediate reversal of what Margaret has been asked to do, and that they, the ethics board, comply fully with the ruling and the decision of the Attorney General's office that was used in an attempt to place further restrictions.
Anyone else? Is there any new business? Rita?
Just about the fees and penalties on homeowners that couldn't pay their taxes. That might even be under old business, but we never addressed what we were gonna do with that. And I think that we should, because that's the, other than the DMV, that is the number one thing I get a telephone call about every day.
I believe Mr. Burke has his hand.
Mr. Burke?
Old business, Joe. I want to bring up again my concerns about the Community Services Board and awarding the contract to St. Lawrence Health Systems. I'm just going to say it one more time. It was done with, in my opinion, without due deliberation. It was done without an interview of any of the entities. It was a paper review. Most of the people doing the review, as a matter of fact, all of the people, except possibly one, had no background in substance abuse. It is the first time that I can recall of the Community Services Board ever doing an RFP. I can name you organization after organization that came into this county, and they never sought to do an RFP. And I'm not opposed to it in principle, but I have to ask why the sudden deviation. And I'll tell you how I view this. I view this as a diversion of taxpayer money to a private entity. We, the St. Lawrence County, were asked to do the methadone clinic. Nobody else was asked to do that. And it has the potential, or had the potential, to turn around our balance sheet for all the services that we render. It's 1.4 million projected during the first full year of operation that we have essentially robbed from our taxpayers, and that in addition to that the losses associated with this to our current services are significant. I mean, when this, which is listen, I'm wholeheartedly in support of the methadone clinic. I am not wholeheartedly in support, and I'm not in support at all of the process that was used. This is a big amount of county money that has been diverted to a private entity. Kevin Akers, you sat on the board. You said that unanimously people all voted for the same thing. Well, I'm going to tell you, it requires an external review. It requires an external review. I personally do not have confidence that, given the facts that I just outlined, that a fair consideration was made. I think we've shortchanged the taxpayers of St. Lawrence County, and I think it's the wrong thing to do. And one other thing, and this wasn't on the sheet. I looked at the sheet. Again, just going to say the metrics used, the first 30 points were basically a description of your organization. And in addition to that, they failed one big metric. They failed to mention one big metric, and that is if somebody can't afford to pay. If there's somebody who presents for services that can't afford to pay, St. Lawrence County has always been a provider of last resort. We've never turned anybody away for not being able to pay. And I ask you, is that true of St. Lawrence Health Systems? Is that true? Do you know that off the top of your head? And if you don't know that, why wasn't it asked? Because that's a critical, access to services is a critical point. And it was nowhere on the metrics, among other things. But I remain concerned, and I'm firmly committed to asking for whatever help I can in having some independent entity take a good long look at the process that was utilized.
Anybody else? Ms. Haggard?
I don't know what happened to my picture there, but anyway.
We can hear you.
Okay. Oh, I know what
I
happened.
said, go ahead, we can hear you. There, you're back.
Or on mute.
Now you're on mute.
I apologize, that was my fault. Further on what Mr. Burke brought up, and since we are so concerned with ethics and transparency on our board, I believe, and I'm not sure, I would pose the question. I believe there are people on the Community Services Board that actually report or are affiliated with the hospital. That concerns me. I am not accusing, I am not saying anything, but I'm asking for transparency. I have heard this from constituents, and it is something I think should have been revealed to, having come in late to this entire process, I would have liked to have known that. Thank you.
Anyone else? Ms. Curran?
So regarding the Community Services Board and having all of this done, you know, when James first brought this to us, he said, listen, these patients need a higher level of care than what we can give them. They need this methadone daily dosing. They also need additional services. They also need additional things that we do not provide. One of the things that makes St. Lawrence Health System a good fit for this, I think, is that they do have all those services already in place. They do have a system where if someone cannot afford care and they need services, they have charity care, they have social work to hook people up with services to make sure that they can have the programs. And I just really think that people are always forgetting that county is here to give services that no one else can and will provide in a meaningful and useful way to the patient. We are not here to think about whether or not we need to balance one area of our budget with the federal and state funds that someone wants to give us. And that is better for the county than to allow somebody that is probably better suited with numbers of people and places that they can give people therapy than maybe what we have.
Thank you. Anyone else? Mr. Burke.
Well, Rita, I'll address this to the chair, but here's what I would say. This wasn't, for me, this wasn't strictly about the finances. I mentioned the finances because there's a whole group of you who love to focus on finances. To me, this is about the quality of the services. And when you don't have good metrics, when you don't have people who know what they're talking about, doing the review, then how can any of us, and when you don't take the time to interview these agencies, how can anybody be comfortable with the fact that it was done objectively? So let's put the finances aside. I only like to throw in finances because I know how much it means to a number of you. So it's 1.4 million, 1.4 million. So, and Rita, I assume you haven't taken the time to read the proposals, because last week you made mention before I was cut off. And again, I apologize for addressing you specifically. So I'll just say, last week it was mentioned that there won't be any stigma attached to Canton Potsdam Hospital's clinic, the use of the mall, because they'll all go in and out the same exit, all in entrance and exit. That's not true. Read the proposal. The proposal has everything that's needed. Everything that's required is there. As a matter of fact, Jay went to the effort of contacting the people at Credo, the people at Catholic Health Systems, to make sure that our proposal was a solid proposal. So the idea that St. Lawrence Health System is somehow better equipped to do it is pure hogwash. There isn't a shred of evidence. Read the proposals. Read the proposals. Thank you.
Ms. Haggard.
Thank you. I think Mr. Burke is far more qualified to talk about this than I am, but I will say that my definition of what the county is here for differs greatly from other people on the board. We are not here to take up the slack when privatization isn't possible. We're here to serve the people of the county and not look for ways to shirk our responsibilities.
Anyone else? Seeing none, we have need for executive session. And I'd entertain a motion to go into executive session. By Mr. Sheridan, seconded by Mr. Forsyth. All in favor?
Aye.
Opposed? Carried.